Hi, everyone. Good morning to everyone in Hong Kong, and good evening to those dialing in from the US and the UK. A very warm welcome to the analyst presentation of Prenetics. I'm Sabrina Chan. I'm the head of investor relations at Prenetics. I joined the company 5 months ago, and before that, I was with Goldman Sachs in the investment banking division, and subsequently with the private equity fund, leading the investor relations and fundraising function. First of all, let me give you a very quick background about Prenetics and our upcoming merger with Artisan. On September 16th, we announced our proposed business combination with Adrian Cheng's Artisan Acquisition Corp. And since then, we've made tremendous progress. On November 10th, we publicly filed a registration statement on Form F4 with the SEC. And we made our first earnings announcement posting very robust first half 2021 financial results. We've already exchanged 2 rounds of comments with the SEC, and we're well on track to list on NASDAQ in the first quarter of 2022. Today, we're very excited and honored to have a number of speakers joining us all over the globe across different time zones. Joining us in the Hong Kong office, we have Mr. Danny Yeung, the Group CEO and co-founder of Prenetics, Ben Cheng, CEO of Artisan Acquisition Corp, Stephen Low, our Chief Financial Officer, and Dr. Mike Ma, our Chief R&D Officer. And joining us from the UK office, we have Avi Lazzaro, the CEO of Prenetics EMEA. And lastly, joining us from the US, we have Dr. Frank Ong, our Chief Medical Officer. Now, please take a moment to review today's agenda. We've budgeted 30 minutes at the end for Q&A session. You may post your questions in the Q&A box on the Zoom webinar during any time, and we'll take all the questions in one go at the end. And for those joining us in the Hong Kong office, we've arranged a tour of our ISO 15189 accredited laboratory after the presentation. And our laboratory is located just across the street from here. Without further ado, let us welcome Mr. Danny Yeung to give us opening remarks.
Thank you, Sabrina. Hi, everyone. Good morning, everyone. Thank you so much for joining us in person here today in Hong Kong. For the individuals dialing in from the US and UK, thank you so much as well. Quick background about myself. I'm Danny Yeung, co-founder and CEO of Prenetics. Short background. So my relevant background is that I basically, this is my 4th company I started from scratch. I grew up in the US. I moved to Hong Kong back in 2010. When I moved to Hong Kong, I started a company called You Buy, I Buy, which was a group buying website, and that was subsequently acquired by Groupon after 6 months of operations. After the acquisition, I led actually Groupon's Asia operations as CEO and led it to become the largest e-commerce company in East Asia. I fully exited back in 2014 and then started investing in early stage startups. Via investing in early stage startups, I still felt very passionate about doing something entrepreneurial again and wanted to actually tackle into the healthcare space. So that's why I started Prenetics. The name actually Prenetics comes from prevention and genetics as a combination. So certainly in terms of our journey, it's been quite crazy journey because when we started back in 2014, we only had 7 people in a very small laboratory. Now, 7 years later, we've now grown to over approximately 800 people globally, operational in 9 countries. And certainly our mission is to decentralize healthcare and bring healthcare closer to the patient. And then while we have grown significantly over the last 7 years, we believe we're just getting started. Next. In terms of ultimately what we want to achieve and do. So as you can see here, this is something very, very impactful. So basically what we believe is that we want to create a healthcare ecosystem comprising of digital health, testing services, rapid diagnostics, coupled with laboratories, and eventually coupling it with prescription medicines that via telehealth that can be delivered to your doorsteps. And then so this is very, very challenging, of course, but no one's actually done it before. But if we can actually execute on this, there's a significant opportunity for both an impact as well as a commercial opportunity. In terms of understanding Prenetics in 5 questions. So in terms of what problem we are solving. So if you look at this wise, what we are solving is basically, you can see healthcare is actually very, very fragmented. A lot of times healthcare, you actually need to go to a clinic, hospital to perform the tests. We believe we can bring healthcare closer to the patient without you actually having to leave your home, or that you can get the healthcare done in the point of care setting. In terms of how we do it, we do this by 3 different business pillars, from our prevention testing, diagnostics testing, and personalized care testing. And that each of these test products are actually very innovative health solutions catered towards a patient. In terms of what have we accomplished, so certainly we continue to scale at a very, very fast rate. If you look at our first half revenues, which we already published last month, we already achieved 136 mil USD in revenues, well on target to achieve our estimated revenues of 205 mil USD. As mentioned, we grew from a very small laboratory now having a very diverse international team of over 800 people across 9 countries. In terms of how will we further grow, certainly we believe that we can grow organically via a robust product line. And certainly with the IPO proceeds, we expect that we'll be making significant M&A acquisitions on a global basis. Because with the capital on hand wise, certainly I think this will be very, very exciting for us to execute on this. And certainly, what is the potential of Prenetics? Again, as you see in the earlier slide, we believe we are building out a healthcare ecosystem comprising of different testing, different services in a combination of rapid diagnostics as well as digital health. And as mentioned, with the proceeds of the IPO, we believe we're very, very well positioned to capitalize on this market where individuals and consumers and patients want access to quality healthcare around the world. So with that, I will want to pass it to Ben Chang, which is the CEO of Artisan Acquisition Corporation, for his remarks.
Thank you, Danny. Hi, everybody. Good morning and good evening for those that are in the States and Europe. Thank you for your time today. My name is Ben Chang. I am the CEO of the Artisan Acquisition Corp. My career is that I'm also currently the managing partner at C Ventures, which is a VC fund founded by Dr. Adrian Chang. Okay, so from my career for the past 6-7 years in VC and private equity investment, our goal is to find out disruptive and rapidly growing company. And when we first decided to merge with Prenetics, I think we have discovered these characteristics in Prenetics company. Okay, so we can pass that. Yeah. So when we were looking for our acquisition target for our SPAC, one criteria that I always ask the team is that how much of growth has it been experiencing in the past couple of years, right? When we look at Prenetics, first of all, we like it so much because from 2019 to 2020, they grow more than 6 times in terms of revenue year on year. And from last year to this year, based on the current projection, is expected to grow another 3x. So this is exactly the threshold this is actually our starting threshold before we select a company. On top, what we like a lot, obviously, is the current product portfolio and obviously the pipeline down the road. That part I'll let Danny and Avi share with you down the road. Okay. Last but not least, one thing that we really like about Prenetics is we see a lot of synergies with Adrian's ecosystem. Okay, Adrian ecosystem, every single day, we have more than 14 million people coming in and out of our ecosystem because Adrian's ecosystem spans from shopping mall, retail stores. Obviously, we are also in healthcare, education, and other sectors and so on. So imagine, for example, there can be synergies with Adrian's ecosystem in Gleneagles Hospital and also Easy Healthcare, a healthcare company that we invested in Hong Kong. On top, we can do a lot of synergies with our existing residential and retail operations across Greater China. So this is exactly what we're looking for in our acquisition target, is that apart just from money, we're looking to offer help and support in our business wise. Okay, so I think that is also the reason why Danny picked us, because he's not looking for a partner just providing capital. He's looking for a long-term partner that has the same vision and provide long-term support to him. Okay. Speaking of the transaction itself, we decided to merge with, we announced to merge with Prenetics, giving them an enterprise value of 1.25 billion US dollar. In our deal, we also raised a spec with 339 million in our trust account. On top, we announced that we have raised 60 million of FPA. We're very honored that our FPA investor include Aspects and PAG, both are very renowned investor in the region. On top, we also announced that we have raised additional 65 million of PIPE in this process, and I think we can all find the details in our announcement. Okay. And then let me pass it on to the team to talk more about the company.
Thank you very much, Ben. I would like to introduce Danny to come back up to stage to talk about our business vision and the current presence of Prenetics.
Thank you, Ben. Just a side note on BenWise, right? And also Artisan Acquisition Corp, right? So I think when we decided to merge with BenWise, right, and Adrian, we actually had a lot of options, and so did Adrian and Ben. But so certainly they seeked out 40 to 50 plus companies. We spoke to a lot of different SPACs. We looked at a lot of different listing options, and was very clear there was a lot of synergies between Adrian and his ecosystem and us. So we felt very, very excited about the long-term synergies. So that's why we're confident moving forward. Wise, we already started a few different partnerships with the ecosystem, Easy Healthcare, Glen Eagles, etc. Wise, where we believe we can actually integrate a lot of our testing services within that ecosystem because they reach so many different consumers on a daily basis. So thank you, Ben, for having the support in us. So as mentioned, in terms of what we do, next slide. So this is what we aim to do by 2025. So as mentioned, we have three different pillars of the business currently today. So we have the prevention business, which revolve around Circle DNA as well as Colo Clear. And later on, we'll actually go in detail in terms of each of our products. With our diagnostics business is with our Project Screen for COVID-19, Circle Health Pod, which is a rapid diagnostics device for all infectious diseases, Circle Snapshot, which is an at-home blood collection device, Circle Medical, which is genomics for physicians. And lastly, with personalized care is a real about supplements and prescription medicines tailored towards individuals' needs. And so what we are forecasting now is by 2025, we aim to achieve over 600 mil USD of annual revenues. Where we are currently today. So right now, we will certainly be considered the leading genomics and DNA testing company in the UK and in Hong Kong. We have raised over 85 mil USD from strategic investors, including Prudential Insurance and a few others. We operate 11 laboratories around the world, including in Hong Kong International Airport, as well as in London Heathrow, two of the biggest airports around the world. We've processed over 6 million tests globally. As mentioned, this year, we've forecasted 205 mil in revenues. But right now, when we look at our figures wise, as mentioned, through the first half of 21, we've already achieved 136 mil. So we're well on target to achieve, beat those revenue estimates. On the right side, you can see for each one of our products, we have a very, very strong competitive moat and strong USPs associated with our product line. So that we feel, at least in the markets that we operate, there's very little competition. Next. So this is also, you see, we have a very strong financial growth with a very diversified footprint. Over 50% of our current business is actually from our UK business. This year wise, first half wise, as mentioned, we have an adjusted gross profit of over 57 mil USD, coupled with 136.5 mil USD in revenues, right? As also very notable, even without the IPO proceeds, we have roughly almost 100 mil USD in cash and receivables, so which gives us puts us into a very healthy financial position. As mentioned, we have a very global presence, operational in 9 countries. We have an EMEA headquarters led by Avi Lazzaro in London. We also have our Asia HQ here in Hong Kong and operational in Southeast Asia as well. We also have a very strategic R&D collaboration with the University of Oxford This was the result of last year, during the COVID time, where we actually acquired 100% of the IP associated with a rapid diagnostic reagent developed by University of Oxford. Certainly, when we made the acquisition, there was still a lot of uncertainty revolving around COVID, but we felt even at that time that COVID would be here to stay for much longer than everyone imagined. And certainly, I think with everyone can see with the Omicron variant, it is proven very, very true that I think testing will remain for a while. And given our strategic relationship with Oxford Wise, we're further working on product pipelines, further working on molecular diagnostics. So this becomes a very strategic relationship for us. And at the same time, Oxford University is also on our cap table. In terms of our management team, I think this is also something very unique for us in terms of we have a very diverse international group of accomplished executives. As mentioned, myself-wise, I had lots of different entrepreneurial backgrounds in my career. Stephen, our CFO, which was from Citi, Lawrence, our Chief Scientific Officer here from the beginning. Avi Lazzaro, our EMEA CEO, which was a result of our acquisition of DNA Fit back in 2018. Mike Ma, our Chief R&D Officer, which was formerly with Exact Sciences. Dr. Frank On, our Chief Medical Officer, which he was most recently with Everlywell, which was the leading blood-based testing company in the US. And certainly we're backed by very strong key scientific advisors, Professor Trey from Oxford, Professor Huang from Oxford, Dr. Monique Anderson, and Professor Michael Yang. In terms of next slides, I wanted to actually have Avi speak to us from the UK. So Avi, thank you so much for staying up so late. So next few slides, Avi will go in detail in terms of our EMEA presence and what we are doing there.
Great, thank you very much, Danny, and good morning and good evening to everybody. I'm Avi Lazzaro. I'm, as Danny indicated, the CEO of Prenetics here in EMEA. Next slide, please. Just a bit of background before I take you through some of the Prenetics EMEA story. I met Danny actually in approximately 2017. And together, we kind of aligned on the fact that we have such a huge possibility ahead of us to use genetics and digital tools to actually make an impact on millions of people's lives. And really, we started to do that by what we've done here in the last 18 months or so since the acquisition. So very, very quickly, a bit about myself. I've also come, as you've seen, from a Citibank background. I've also had entrepreneurial endeavors, and exiting DNA Fit into the Prenetics group was actually a second exit for me as an entrepreneur. Very quickly after the acquisition of Prenetics of DNA Fit took place, the company actually won 2 Queen's Awards. And those Queen's Awards are actually the highest accolade in British business. Obviously, Her Majesty the Queen's organization endorses that. And we won that for both innovation and for export. So we're really proud of that. Certainly coming together with Prenetics at the time, DNA Fit was very much focused on a consumer proposition. Prenetics in HK were working quite aggressively on a B2B to C play. And we were encouraged to actually move very fast, pivot and actually take our DNA Fit proposition into a B2B enterprise offering. So very quickly we partnered with Investec, a private bank in South Africa, to offer that to their clients. We also built some white label platforms, one of them for Bupa, a leading healthcare insurance company here in the UK, as well as Generali from Italy and Aetna International. Core to our strategy, of course, is research, and offering these genetic products, we want to make sure that we are publishing research as frequent, as often as possible. So very quickly, we had a peer-reviewed paper looking at genetics and nutrition, which was core to our offering as part of our DNA Fit product. In the final part of Q4 2019, we launched collaboratively with Danny and the team. We launched really the world's most comprehensive consumer genetics product, which is Circle DNA, 500 reports across 20 categories into the UK and EMEA markets. As we all know, the pandemic impacted us all, and very, very quickly, our small team of 30 people at the time here in the UK had a pivot to understand how we can really drive our mission forward and do something, and do our civic duty towards supporting the COVID-19 outbreak. So we were the first company that essentially, in that first initial lockdown period, successfully won the UK English Premier League as a client. And That was known in the UK as Project Restart, and really was a showcase for how private laboratories and companies can work with such organizations for the first time in such a unique situation. This became a gold standard. And as a result of that, not just did we open the sector and have sports return to behind a closed door setting, but actually it became a gold standard for other sports. So very quickly after that, we rolled out into the English and Wales Cricket Board, British boxing, and others, using that gold standard that we pivoted to do to help deliver the success that we've done. And that, of course, didn't just include testing, it also included digital health. So in fact, even today, as the UK English Premier League continues to renew their contracts with us, we also operate digital health passports for them within that ecosystem, which we built and innovated here at Prenetics. Very quickly after that, we were successful in winning a major film studio, the Walt Disney Company. And today we deliver all of Walt Disney's testing program, as far as we're aware, in the UK, as well as other countries. So that includes Ireland, Italy, and countries wherever their productions are filming. Again, that was very unique. So we opened up the film sector by being the first to market in developing a gold standard, which others have since followed. Shortly after that, we were then involved in opening up of the first flight path at Heathrow Airport. So as we all know, airports were locked down, flight paths were locked down, but through the innovation of the Oxford University Group and using the LAMP technology, which we later acquired, we were able to very quickly help assist creating a standard in which the first flight path was opened up between Heathrow and Hong Kong. Moving forward as well, we then, again, were the first company to set a standard, a gold standard in opening up the cruise liner industry. And we won Carnival Cruises as well as Disney Cruises, helping to set up embarkations for high volume passengers getting onto these cruises, up to 3,000-4,000 in 4-hour periods, not just again testing, but also providing the technology and the ecosystem to deliver success in those environments. Moving forward to today, the testing that we do and the work that we do with these clients on these cruises isn't just embarkations, but it's also, of course, working on the cruise liners with laboratories on these cruise liners or remote environments where, for future-wise, they're looking to run tests and surveillance for all sorts of other sorts of tests in those environments. Moving forward again, we were successful in winning Virgin Atlantic as a preferred partner. Of course, Virgin and Delta work very much closely together. So we are the provider and the preferred provider for both Virgin and Delta here in the UK. Moving forward again, we've continued to work with government. So, running multiple projects in Her Majesty's Prison Service, helping to go into the prisons and perform testing services within, as well as working with direct to consumer, being one of the first companies on the government's travel approved list of providers in all aspects for test to release, day 2 arrivals, and day 8 testing as well. Most recently, we also were asked to innovate and work with government on a project around some surveillance testing and pathogens in wastewater as well. Next slide, please. So just in summary, we've generated as of half year approximately 67.7 million revenue. We've done 1.8 million tests, and we operate actually 8 laboratories in total, mixed between 2 fixed laboratories, as well as some airport laboratories and mobile laboratories around the country. Again, the testing that we see and that we do in the airports, and Danny, of course, mentioned Heathrow Airport, but in fact, we're working with multiple airports around the country, as well as, Virgin Atlantic and other airlines now as well. And, we definitely see that testing in airports and in a travel setting would likely be here for some time to remain. I discussed cruises. We discussed how embarkation testing was the initial footprint of that business, but now we're working a lot deeper with these relationships where we are testing and working on the cruise liners across the country as well as these ships sail. We continue to work with sports. We of course are focused heavily on working with government and enterprise clients as well, very important, of which we are starting to develop deep relationships because of the work that we've done with COVID, with all these brands and more that you see in front of us right here. Next slide, please. So just in summary of our capabilities, I talk about these 8 laboratories, but I'm also pleased to say we've integrated with a number of laboratories in Europe. And why this is quite important is some of our clients have asked us in the cruise liner business, for example, to mobilize operations in Italy, Ireland, Copenhagen. To do that, we've had to obviously understand the landscape on the ground, integrate with laboratories, but that positions us very well for when we bring new diagnostic products to market, because those integrations are already done. It will help us actually deliver to our customers in those countries in a much more efficient manner. Care Quality Commission is a accreditation which we have here in the UK, as well as we have been recommended now for our ISO 15189 laboratory accreditation. The latest standard is 22870, which is a testing standard for taking swabs across the country, as well as our data information security architecture standard 27001. So although a lot of these standards, were in some cases put into place, of course, during the pandemic, they put us in a really great position to position us for future frameworks that are needed to continue to win great enterprise clients who expect nothing less of such certifications. Of course, as we've scaled up our D2C operations here for the COVID testing and travel, we've obviously built deep integrations into Six Sigma Fulfillment House, which is giving us really strong last mile propositions. So as we now integrate our future home health products, these last mile propositions are going to make a real difference in delivering to our customers. Finally, we have a 24/7 call center operation manned with 120 people, and not just are they doing call center standard activities, but they also are competent in doing telehealth. So for example, as travelers enter into the US, telehealth consultations become extremely important. Within our core competency, DNA Fit, Circle DNA and others, telehealth is going to be fundamental, and we now have those capabilities and that track record of delivering telehealth quite successfully. Thank you.
Thank you very much, Avi. Now I'd like to pass it on to Dr. Mike Ma to talk about our product and technology.
Hi, good morning to everyone here, and good evening to everybody online. My name is Mike Ma. I'm in charge of the I'm the chief R&D officer in charge of the research and product development, and also overseeing the clinical operations. Before I get into the detail of the product and technology, I want to have a self-introduction and tell you a little bit about myself. I have 29 years of research and product development experiences, and I have over 30 international patent and patent applications published and issued. Before joining Prenetics, I started my career with a startup company in the United States. I received my scientific training in the US, and then started out my career in a IVD company, and where Kevin Conroy actually was the CEO, and we successfully developed the HPV test. At the time, cervical cancer screening are mostly done by pap smear and colposcopy. However, with this game-changing, molecular diagnostic, actually we were able to launch the product, get the FDA approval, and also took the company IPO. With that, later on, the company was acquired by Hologic. So I was transferred to Hong Kong to oversee basically the molecular diagnostic business and also technical support. Whereas Kevin Conroy went on to start the colorectal cancer screening test development in Exact Sciences. 6 years later, we united basically our Exact Sciences is interested in entering the Asia Pacific market, and at that time, actually 2015, that's the time that I first met Danny, because we find that Prenetics is our strategic partner. We established a laboratory here to provide the colorectal cancer test. And now, 6 years later, once again, I'm here with Danny, and here I'm not only we have one game-changing technology and product, and as you can see, we have multiple ones here, and we are about to start our new chapter of a very exciting journey. And we believe that these are all, we are not only innovator, but we are the first mover. And as I've looked back, we have Prenetics has a lot of similarity as Exact Sciences, because we have the people here very energetic, agile. We are passionate at what we do, And also we are committed to the community. We want to bring back and we want to contribute to the community and our society, especially during this pandemic time. Okay, so as Danny earlier mentioned that our mission is to decentralize healthcare, and we want to bring health closer to people. In doing so, we have three core area of technology and products. The first one is prevention, second one is the diagnostic, and third one is the personalized care. And I'm going to touch on the prevention and diagnostic products. As you can see, CircleDNA is the world's most comprehensive consumer genetic test. And we launched this product in 2019. And up to now, we have already delivered over 120,000 tests. And we are the leader in Asia and UK in terms of the consumer genomics. And one of the quick advantage and the fundamental differences of our tests is we can provide 50 times more data than our competitor. And as you can see, the market, global market share is big, and this sector of business is fast growing. Next slide. As I mentioned, this is our fundamental differences and the competitive advantages, our technology based on whole exome sequencing, whereas our competitor is using genotyping technology. As I mentioned, this test, our technology provides 50 times more data, and it is a one test once and for a lifetime. So we have all these informations and continually can update and provide additional report. As you can see from the slide, 23andMe with the genotyping technology, they can provide 125 reports, whereas our whole exome sequencing technology can provide over 500 test report. Next. So Avi also mentioned, right, with the 500 over report, we also cover 20 multiple categories. It's the most comprehensive genomic test up to date. And not only that, we provide these comprehensive reports, and these reports are anytime, anywhere accessible through our CircleDNA app. And we also supported the customer with genetic counselor and also a health coach for consultation. And with that, we think that we can provide a complete consumer journey experiences. Next slide. This is a very busy slide, but the bottom line is, if you look at our technology, the uniqueness about it is, as everybody knows, the whole human genome has a lot of information. And if you look at this slide on the right, basically our technology is taking pieces of this information and stitch them together to provide a book of life. Basically, in this book, you can read into the content, and then we can predict and also find out the potential risk and also and trace of an individual. And as we mentioned before, the fundamental differences is our competitor genotyping technology looking only at pages of the information, whereas we have the entire book. And as new scientific findings arise, we can always go back into the book and then find out more report and knowledge about the individual. Next slide. Next, I want to touch on the ColoClear product. This is only non-invasive colorectal cancer screening test approved by the China FDA, also known as NMPA. I mentioned earlier on with Exact Sciences, they also developed colorectal cancer screening test. And colorectal cancer is one of the diseases that's most preventable, however, is the least diagnosed. If the early detection can lead to early identification of the person with this colorectal cancer risk. And if with the early detection, the survival rate is significantly higher than those people who are not screened. So, however, currently, the gold standard of the colorectal cancer screening is colonoscopy. This is a very uncomfortable procedure, and it's the least compliant methodology for screening. So, with that, we find that this our ColoClear product has a great sensitivity, and also is very cost-effective, convenient, and easy to do, and very easily adopted by the customer. And we expected this product will be launched in the first half of next year. Next slide. I just mentioned about currently the screening tools. There are basically two types of screening tool. One is invasive and one is non-invasive. Invasive, as I mentioned earlier, the colonoscopy. Everybody know that this is not only a screening tool, but also actually is a surgical tool, surgical procedure. That's why it's expensive. It has to be done in the hospital, and it's also very uncomfortable during the preparation procedure. And also it involves some risk factor as well because of the procedure, of the surgical procedure. On the other hand, there's a non-invasive screening tool. Given the sensitivity of the screening of this non-invasive screening tool is not as sensitive as the gold standard colonoscopy. However, it's easily can be done not only in a hospital, at the clinic, or even at home. Next slide. Now, as we look into this non-invasive stool-based test, there are basically two different categories. One is on the left side, you can see the FOBT and also FIT. These are basically non-invasive tests looking at the stool, the blood inside the stool. Whereas on the right side, tack on top of the blood detection in the stool, this technology also look into the DNA biomarker to assess the risk of the colorectal cancer and also lung cancer, pre-cancer risk. Next slide. Now, I mentioned that earlier on, Exact Sciences developed this colorectal cancer screening test. It is also fallen into the same category as the FIT DNA test. Our ColoClear test also is in this category. So as you compare of all this on top the non-invasive screening tool, our test, the FIT DNA test, ColoClear provides the highest sensitivity in detecting cancer, as basically the sensitivity is as good as the colonoscopy. And in terms of the AA advanced adenoma, which is a pre-cancer, and our test in terms of the non-invasive test has the by far highest sensitivity against other non-invasive tests. Next slide. So now I want to get into the diagnostic products. The first one I'm going to touch on is our Project Screen by offering the COVID-19 test in the past couple of years. As Avi earlier mentioned, that we have been proactively taking the COVID-19 test, not only offering the test from our laboratory, but also we take it one step further into the airport. In Hong Kong, we also offer the test in the community center. And recently, we offer the test to support the Hong Kong Marathon. And also a lot of the sporting event in the UK, just like Avi mentioned before, the Premier League and at Disney film shooting and etc. Basically, with our infrastructure, right now we have a capacity in UK testing over 10,000 COVID tests, molecular tests per day. In Hong Kong, we have a capability of testing over 40,000 molecular tests each day. The gold standard sensitive the most sensitive, accurate test. So in Hong Kong, at the airport, Danny also earlier mentioned, we are the only laboratory inside the Hong Kong International Airport that offering the COVID-19 test. And in the most recent development, as everybody knows, Hong Kong has 4 Omicron variants, and they were all detected by our laboratory. So we have identified 3 positive Omicron variants from the inbound traveler because they were at the quarantine hotel. And interestingly, the 4th one is actually inside the airport. The passenger actually was in transit to another country. And so we are very proud that our technology, our service, not only can protect Hong Kong, but also safeguarding people, traveler towards other countries as well. Next slide. So in terms of the COVID-19 testing, basically, you can divide it, the technology into 2 categories. One is looking at the protein level of the virus. The other is looking at the nucleic acid of the viruses. So as you can see from the right side, the antigen test, everybody know that is very convenient, fast turnaround time in terms of reporting the results. However, it's not very sensitive, especially for the asymptomatic patient. As you can see, only 27%. So basically, it's like even less than flipping a coin, right? So obviously, the other one looking at the nucleic acid, because it's an amplification technique, so it is a lot more sensitive. However, it requires a very complicated and expensive equipment to do so, and the turnaround time is very long. So by combining the best of these 2 worlds, actually, if you look at the RT-LAMP technology, the turnaround time is fast. The equipment involved is not so expensive and not so complicated, and also it doesn't require a stringent laboratory environment like the PCR. And last but not least is the scalability. Because of the scalability, we can perform using this technology RT-LAMP in various settings, as next slide illustrated. So believing that this RT-LAMP technology is the technology that combining the best of the two techniques. And last year we acquired a technology, this Oxid lamp, which is based on the RT-LAMP technology from Oxford University. And it is indeed a game-changing technology that can lead to point of care and also at home testing, because of the benefit that I just mentioned before. Because of this Oxid lamp technology provide high accuracy, rapid to results, easily scalable, and the cost of setting up the testing is low. And last but not least, because of the scalability and also the ease of use, we can apply this test to various settings. And because of that, next slide, please. By using this technology, we developed our at-home and rapid detection system called Circle Health Pod. Next slide. Oh, okay. We can look at the video first. So as you can see, there are a lot of information already in the video. And actually in my pocket, I'm going to pull out my health pod. So it's indeed a lab in your pocket. You can carry it around. So the beauty of these devices is as we can see in the video that we invest over almost 30 million USD into this technology and development of this product. It can provide less than 30 minutes. You can see it will provide you the results. It has the overall concordancy to the RT-PCR technique, 98.4%. So it's truly a PCR quality technology, like the gold standard. COVID-19 test is the first product in the pipeline, but we are also developing influenza tests and also other sexually transmitted disease detection as well. Next slide. We already achieved the CE marking with, and if you look at this device, right, actually composed of not only just the device in itself, it was actually manufactured by a contracted manufacturer in China. And then we also, if you look at the consumables, one of this is also manufactured by a contract manufacturer. This is a sample collection device. So basically, you put after you take the nasal swab sample, you put it into this specimen collection tube, and then we have another consumable capsule that contains the reagents inside these microfluidic channels and chambers. So we also have separated manufacturer. They are all ISO 13485 certified with good quality management system. And as simple as that, you can just pop it in and then put it in a device. And in 30 minutes, you'll get the results. So I mentioned already, next time, we have already received the CE certification, and we'll for the professional use, we are now in the preparation to apply for the at-home use with a EU notified body assessment. In the US, we are also planning to apply for the emergency use authorization. And we have already completed the usability study. And right now, we are in the process of doing the clinical validation. With all this certification and approval, we will look into the Asia, India, and South Africa market as well to fulfill the local regulatory and license and approval process. Yeah, with that, I think we are, as I mentioned, we are not only holding just one game changer technology or product. We have, as you can see, we have multiple 7 different products and technology that actually Prenetics is planning to introduce to the market in the coming years. As the Prenetics story continues, I think we are very excited and we are very honored that we will be able to provide all these and introduce all these new products to the market and bringing the healthcare closer to people around the globe. Thank you.
Thank you very much, Mike. With that, I would like to pass it on to Dr. Frank Ong to continue talking about our product and technology.
Good morning, everyone in Hong Kong. Good evening, everyone in North America and Europe and UK. My name is Frank Ong, and I am the Chief Medical Officer of Prenetics. I started my career as a family physician trained out of UCLA after completing medical school at the University of Southern California. I completed my specialty training in medical genetics at UCLA and also a subspecialty fellowship in molecular genetics at UCLA. After a few years as a faculty at Cedars-Sinai Medical Center in Los Angeles, I started my career in industry, first as the lead of medical affairs at Illumina. I then became the head of clinical science at Roche Diagnostics, leading the verticals for medical genetics and women's health NIPT for Roche Molecular and Roche Sequencing. My interest in cell-free DNA testing in precision oncology then led me to become the head of clinical trials and operations at Guardant Health. Prior to Prenetics, I was the Chief Medical Officer at Everlywell, now known as Everly Health. Having known Danny for the past 7 years, seeing how Prenetics has grown over that time, particularly in the last 20 months, and understanding Danny's vision of the multi-billion-dollar company that is to be Prenetics, I was excited to come on board as the Chief Physician Advisor this past summer. Having worked with the senior leadership team, as well as the functional teams in Hong Kong and London, I decided to take on the role of Chief Medical Officer for the group. Having been in leadership roles at successful startups to mega caps and having experience in scaling these growth companies, I have little doubt that with the appropriate resourcing from both the financial and talent perspectives, and with a lot of hard work, Prenetics will scale to become that multi-billion-dollar global organization that Danny has always had in mind. In this slide, I will introduce the Circle Snapshot. The Circle Snapshot is a portfolio of more than 50 tests, ranging from diagnostic tests, such as sexually transmitted infections and diseases, to wellness tests, such as men's and women's hormones, as well as food sensitivity. Blood collection at home to certified and accredited lab results reviewed on a digital health platform has been proven to be a successful model to decentralize healthcare and increase the accessibility of laboratory testing by further driving down costs with increasing volumes of testing from the convenience of the customer's home. This global market size of over $6 billion does not include COVID-19 testing, nor other at-home tests that do not require central laboratory testing. Next slide. The Circle Snapshot end-to-end solution begins with online or in-store purchase of the test kits, followed by registration with a Circle account, upon which the kit is activated in the Circle app. Our customer then collects a small amount of blood samples with a painless, self-administered device that is cleared with the regulatory agencies. The blood sample in a small microtube is returned to the lab for sample processing. Within 7 business days, the result can be viewed on the app after a qualified healthcare professional has already reviewed our customers to share with their own doctors for further care management. Next slide. Circle Snapshot is a consumer-centric, easy-to-use digital health platform that focuses intensely on the consumer expectations and market trends. It will be used across many different health categories and therapeutic areas, including men's and women's health, heart health, and diabetes care, as well as liver and kidney function, and a white label solution offering an end-to-end service. In addition to processing of samples and releasing the results, the platform will also include logistics, such as fulfilling and delivering test kits directly to the customer. Next slide. By the end of the first quarter of 2022, there will be a few Circle Snapshot launches, including food sensitivity, heart health, and basic versions of the women's fertility and men's hormones. These tests will be followed by the more comprehensive versions of the women's fertility and men's hormones, as well as general wellness categories tests, such as thyroid function and stress hormones. By the third quarter, we will launch the complete wellness screening panels for men's and women's health. And by the end of the year, we will also be launching the STI/STD panels. Next slide. Here, we're highlighting the functions of the Circle app. This digital platform will be used by the consumer to review test results and recommendations, personalized digital health coaching based on a holistic view from both the genetic background and the biochemical profile over time, with regular screening tests provided proactively to the customers rather than being reactive, customers being reactive to their symptoms. And finally, this is a physician for the consumer's next steps and action plan. Next slide. Moving on to Circle Medical. a genetic testing platform for physicians and healthcare professionals. To put it simply, this platform is Circle DNA for physician use on steroids. This platform will utilize the latest in next generation and next generation sequencing technology, combining the latest in short read technology as well as long read technology, an innovative approach that enables both genetic and epigenetic testing. The global market for Circle Medical is over $59 billion US, where companies such as Invitae, Natera, Illumina have been successful. From my own personal, I'm very excited about the Circle Medical product. Next slide. Next slide. Circle Medical embodies the maturation of the Prenetics genetic testing offering, moving into the medical genetics testing world, revealing the genetic basis for these inherited and acquired conditions, as well as providing a targeted and symptoms-based diagnostic genetic testing solution. The flexibility of this platform is demonstrated by the variety of genetic testing from rapid and low-cost single gene testing, for example, where BRCA1 and 2, to monogenic panels in over 15 specialties covered by over 500 panels, to exome sequencing of thousands of rare diseases to confirm the diagnosis. Finally, this platform will cover the most comprehensive genome sequencing in order to elucidate not only point mutations and structural variants, but also complex mutations and non-coding mutations in order to provide insight into the disease susceptibility of thousands of rare diseases. Next slide. We will now get into the personalized care section. Next slide. The Circle One is the embodiment of personalized care, where data-driven and personalized solutions are tailored for each individual customers based on their data analytics. This subscription model platform will generate recurring revenue and maximize cross-selling of all Prenetics portfolio products with an addressable market size of over $376 billion US. Next slide. Leveraging the data from over 120,000 existing Circle customers and utilizing over 31 million genetic data points, the artificial intelligence-driven and trained algorithm will process the combined customers' data to tailor personalized supplements as well as other personalized care solutions. In the next slide, we will demonstrate this holistic approach using an example in personalized nutrition. Next slide. The growth driver, back one slide. The growth driver for the DNA profile-based personalized nutrition market primarily include the increasing need for improving health and preventing diseases due to unhealthy lifestyle, the rising awareness of the benefits of healthcare services, the consumption upgrade and preference for high-quality diets and personalized services, as well as the technological advancements that we've made. Here, we give an example with personalized nutrition. Consumers with variants found on the FTO gene, which affects carbohydrate metabolism, are recommended to increase their carbohydrate intake. This is more accurate than the traditional method of a questionnaire-based personalized nutrition plan. This personalized approach based on genetic data points ensures that the assessment of disease risk is based on the user's genetic profile, which is unique. And with that, the consumer has a stronger sense of participation in their own unique health management. Next slide. Finally, telehealth is another key piece of personalized care to be effective and consumer-centric. Free telehealth consultations will integrate e-pharmacy delivered to the consumer's home, complementing the genetic testing and the biochemical testing that we will offer, such that in the short term, we can unlock the $10 billion US market for personalized supplements. The unique formulas meet individual genetic variations, and the supplements are tailored to each individual's unique biology. This is a monthly recurring revenue generating service that consumers have been shown to desire. The mid to longer term solution includes a Circle F1X and FEM, which will service the $366 billion US dollar market, including treatments for hair loss and erectile dysfunction. So you can see in this section, both Dr. Ma and myself have outlined very interesting and potentially explosive, disruptive solutions that we will take to the market for personalized care. Thank you very much.
Thank you very much, Frank. Now we'll go into a short break and we will reconvene in about 20 minutes. Thank you. Hi, everyone. Welcome back to the analyst presentation. Now we'll move on to the financial summary and we'll have our Chief Financial Officer, Stephen Lo, to present this section.
Hi, welcome back, everyone. I hope everyone is refreshed after the break. And for those in Hong Kong, hope you're all refreshed after the blood draw. We did a demo of the product just now, and I hope everyone is refreshed and ready to start. So first of all, welcome and very welcome, everyone, and thank you for joining us today. I see some familiar faces. Really glad to see you all here. To those that haven't met me in person before, I'm Stephen Lo, Prenetics CFO. So my background is actually quite different from the teams that you listened to just now. I was previously an investment banker with Citigroup. I was focused on technology, media, and telecom investment banking, having completed IPO, equity offerings, debt offerings, M&A, and I joined Prenetics 3.5 years ago. Before investment banking, I was an accountant. I was an auditor with Ernst & Young, where I got my CPA. I'm also a chartered accountant in the UK as well. So my journey with Prenetics actually started before I joined the company 2 or 3 years ago when I was still a technology investment banker. So I was attending tech conferences, typical of an investment banker, and I met Danny in one conference. At the time, Prenetics was just started. It was early stage. And Danny talked about his vision, how he wanted to disrupt healthcare by decentralizing healthcare. And I had a very good impression of him. And then after 2 years' time, we reconnected, and I realized, wow, Prenetics, under his leadership, was able to execute on his vision. He was able to deliver high growth. And I think high growth and execution is a key theme that I'm going to talk about in the financial information session. So if there's only one message I'd like you to take away with, is that we are a high growth company. So if you take a look at this page, there's a few circles here. Each of these pie charts represents our revenue. If you take a look from the left to the right, each pie chart gets bigger and bigger. And it means that our revenue is getting bigger throughout the period of time. So last year, we grew our revenue 7x to 65 million. This year, our guidance is that we'll get to a 200 million plus of revenue. Now, we announced our first half results with strong momentum. Our revenue is 136 million. So if you do your math, we are very comfortably ahead in terms of achieving our full year financial results of 200 plus million. Now, and we will not stop here. What we want to do is that by 2025, we achieve a revenue of 600 plus, and that would provide significant opportunities to us. Now, how we are going to do it? So this page shows you our product pipeline in the next couple of years' time and how they contribute to our growth. Now, if you look at the bottom half of this page, you can see that there are 3 pillars: prevention, diagnostic, and personalized care. And in each pillar, we have new product launches every single year until 2024. So those new product launches are one circled in dotted line. And on the top half of this page, you can see the corresponding contribution to our revenue and how we can get to 600 million of revenue by 2025. Now, I want to emphasize that while we are not putting in anything new in 2024 and beyond, it's not because we do not believe we will not have new product launches. It's that we are only putting in new products and product pipeline that are in near stage or in late stage development cycle that we can actually show you and demonstrate to you. And so with the investment that we're making in R&D, we are very confident that we will have new product launches by 2024 and beyond. And that will provide additional uplift to the revenue that is not currently accounted for in our financial model. Now, COVID-19 is currently an important part of the business, and we got asked about our view all the time about it. Now, with the Omicron variant, I think the market sentiment and the view about the pandemic has changed substantially in the past 2 weeks' time. And also we know that there's a global resurgence in infection rates. We also know as a fact that immunity would subside after a period of time, and there's difficulty getting the developing countries vaccinated. The experimental drugs that we know, for example, Merck, is also very expensive. And so we believe that there is actually a very strong case to be made that COVID-19 will stay for us for a very long period of time. That said, when we do our financial forecast, we take a very conservative view that by 2023, 80% of the COVID-19 revenue will be gone. Only 20% of it will remain. Now, if COVID-19 is to stay in 2023 and beyond, that will provide additional uplift to our revenue that we have not accounted for in our forecast. If travel is to resume, which we believe there is substantial opportunity, then there will be significant uplift to the revenue that we currently have not accounted for. Now, this page shows you a more detailed view about our financial forecast and how we think about allocation of resources. Now, let me first talk about our historical and our first half results that we announced earlier last month. Now, we achieved a revenue of 136 million, and we generated a very healthy profit margin. Our EBITDA is 30 million. Now, that means that we are very healthy in terms of our financial health. However, if you take a look at our net profit and loss, you realize that we are actually accounting for a loss of $8 million. Now, why there's a gap between EBITDA and net loss? And that's primarily because of the accounting non-cash loss. So we recorded a 29 million of revaluation loss from accretion in valuation. It may sound counterintuitive because we report under International Financial Reporting Standard. And in our previous rounds of financing, we actually raised preferred shares from our shareholders. Under International Financial Reporting Standard, preferred shares is accounted for as financial liability through P&L at fair value. It's a very long term with a lot of names. But I think the key thing I'd like to take away with is, first of all, our preferred shares is accounted for financial liability. Secondly, it has to be valued at fair value. What it means is that as Prenetics has grown, our equity value has increased, the financial liability attached to preferred shares has increased. And the last key term is through P&L, through profit and loss. That means the increase in our fair value, the increase in the financial liability would go directly to our profit and loss, the income statement. And that's why, as our valuation has increased, we recorded an accounting non-cash loss of 29 million. We expect that to continue in the second half of this year because we announced our de-SPAC with Artisan Acquisition Corp. And that means that our valuation will continue to increase. And that's why we will continue to increase in terms of our valuation and our loss. Now, that said, it's non-cash. And after IPO, our preferred shares will be converted into common shares. And that means that it would all go away after IPO. And we have seen this accounting treatment in all technology companies that use preferred shares and have done fundraisings before IPO. Now, going back to the forecast and how we think about achieving our goal of 600 million of revenue. Now, we will continue to make significant investment in R&D so that we can deliver on our pipeline. We will continue to make significant investment in sales and marketing so that we can grow our market share, so that we can educate the consumer, the market, the medical community, why they need to do a genetic test. And with that, we will deliver on a very strong result. One thing I like to highlight is that before moving on is that we prepared this financial forecast on a very conservative basis. First of all, we haven't accounted for any M&A that we may do in the next few years' time. We haven't accounted for the new geographies that we are planning to enter into. For example, North America, there's huge opportunity. Continental Europe, there's huge opportunity. And so if we are to do any M&A, if we are to do any geographical expansion to new geographies, hopefully that will provide positive surprises to the market. Now, one thing I like to highlight is that we have a very strong balance sheet. So as of the end of the first half, we have cash on the balance sheet close to 40 million. We have trade receivable 60 million. That means combined, we have 100 million on our balance sheet, and our trade payables is only 22. Also, we do not have any bank borrowing. We do not have any liabilities, financial liabilities other than the preferred shares. So financially, we're very, very strong. And that is enough for our next couple of years' time in terms of what we currently have in our pipeline. Now, before I pass it on to Danny to talk about the strategy and commercialization plan, there are two topics I'd like to share with you. The first of all, it's how we think about our product portfolio and how we think about our businesses. Now, in each of our three pillars of businesses, prevention, diagnostic, and personalized care, we have different products. And the great thing about Prenetics is that each product is actually supported by a successful case study in the US. For example, Circle, we have 23andMe as our peer and comms. They're a $4 billion company. Clear, the comms would be New Horizon Health, which is a $2 billion company. So you can do your sum of the part the way that you want to come up with a valuation about Prenetics. And what's great about Prenetics as a case study is that we have seen this playbook, at least in the technology space before. And in my previous career as a technology investment banker, we have seen successful case study in the US. And when it takes off in Asia and Europe, the velocity that it can come could be very, very fast and catch the market by surprise. We have seen it in e-commerce. We have seen it in social media. And with the recent IPO of Scrab, I think the market is educated as to what the potential could be when Asia and Europe takes off. And so you can do your own sum of the part. But one thing I would like to emphasize is that we are not just sum of the parts of all these products and pipelines. What we are trying to do is to create an ecosystem because we believe 1 + 1 could be bigger than 2. And I think this is something that differentiates us. And Danny will elaborate on how we think about a product and how we build an ecosystem. The second topic I'd like to talk about is M&A. Now that we have a strong financial traction, we have strong cash flow coming in our existing business, and we have strong cash on our balance sheet, we will continue to do M&A. And M&A has pretty much been part of our DNA since very early on in Prenetics. Now, Mike and Dr. Frank Ong, they talked about our organic in-house R&D capability and what we're doing in terms of our product. But if you look back to our history, we have been always doing deals. Starting in 2018. Now, before 2018, we were primarily focused on Southeast Asian market. We do not have any foothold in Europe. And we acquired DNA Fit Life Sciences in the UK from Avi, our EMEA CEO, and bringing on board his team. And now our EMEA business, the UK business, represent half of our revenue. Last year, we acquired from Oxford University the rapid testing technology that Mike introduced to you, and we spent more than a year time to develop it into HealthPod. And then early this year, we established 2 laboratories and research centers with Oxford University, one at Oxford University, one at Oxford Suzhou. And then we are very excited that in Q1, we are launching colorectal cancer test, Clear, through a joint venture with New Horizon Health. And so doing deal has always been our DNA. And if you take a look at the deals that we have done, they come in different forms, type, and size with different strategic angle. But one key theme that is consistent across all the deals that we have done is that, first of all, we successfully integrated them into our platform. And secondly, these deals create significant value to our shareholders. And so with the IPO proceeds, we are not going to have our cash sitting in our bank. We will use the capital to do more deals instead. In addition, we do bigger deals. We'll also look at more geographies and looking to create significant value to our shareholders. And as to how we're going to do deals and how we're going to out all these new products. I'll let Danny to talk about the commercialization and the strategy.
Thank you, Stephen.
Thank you, Stephen. Good to speak again. So the next slides, I'll talk about the commercialization and strategy of Prenetics wise, right? And then I think if you look through the next slides, I think one thing to highlight is that if you look at each of our products that we're coming to market, there's no question if it will work or not. Yeah, because we know it's already been very, very well validated in other parts of the world. So what we are doing is actually making the execution work here in Asia as well as in the UK and Europe wise, right? Starting with our Circle DNA product, as Mike mentioned earlier, we launched this back in late 2019 as a direct-to-consumer genomics test utilizing whole exome sequencing technology. And with this product while it was a very new product in this part of the region, as well as in UK, we've already sold close to 130,000 test kits. This year, projected revenue is almost 20 mil USD. Certainly, we believe this is a significant global opportunity for us to expand further. Next, in terms of our SKUs, you can see here, it's actually quite expensive genomic test compared to the likes of 23andMe and Ancestry.com, right? Because when you compare it to those are typically 49 to 99 USD. And typically they'll lose money on each test they sell to get the data in working with the pharmaceutical companies or subscription model basis. If you look at our product wise, because we're utilizing a whole exome sequencing technology, our base price is certainly much higher. So we start off with 200 USD for our Vital product, which is looking at diet and nutrition, ranging into our most expensive product, which is a Circle DNA Premium, which retails for over 600 USD. And surprisingly, even we found this surprisingly, that approximately 70% of the consumers which are purchasing this test online are opting for the Circle DNA Premium product. Now, we've actually sold and delivered to over 30 different countries around the world. So certainly this has been shown to be a global product, and individuals are certainly willing to pay once they know they actually are able to get value from their product. So certainly in terms of our marketing approach, because certainly we get asked this a lot of companies have failed in this type of more premium genomic test because I think they haven't done a great job in marketing. So in terms of our marketing, we're able to sign up lots of major celebrities here in Asia. We have a lot of above the line marketing, a lot of social media marketing. So we've been able to translate a very scientific product to being a very lifestyle driven product, which certainly has resulted in sales and customers impacting their lives with valuable genetic information. In terms of trajectory growth, you can see even 23andMe, which is the market leader in consumer genomics in the US, it took them roughly 4 years to achieve 100,000 test kits being sold. And it took us less than 2 years to get to 100,000 test kits sold. And by 2025, we expect to sell over 600,000 test kits. And certainly at that scale wise, there's a lot of other opportunities for us to be able to utilize and monetize that data and working with different organizations, different pharmaceutical companies at the same time, which right today, we do not do that. Moving forward in terms of our ColoClear product. So as Mike mentioned, we already know this has been very well established and validated. In the US, Cologuard certainly launched this product back in 2015. Next. And you can see they launched this product in 2015. They had roughly about 40 mil USD in revenues. And last year, they already achieved over $1 billion USD in revenues in roughly 6 years, in roughly 5 to 6 years time, right? Certainly, of course, the market cap is approximately 15 billion USD today. And they're still primarily a single product company with this colorectal cancer screening test. And certainly we believe we have a major advantage here in this part of the region, starting with Hong Kong and Southeast Asia to be able to launch this and commercialize this. Because the value proposition next is very, very clear, right? We have a 10-year agreement with New Horizon, which New Horizon listed earlier this year at Hong Kong Exchange with a market cap of approximately 2 billion USD today. They are focusing on the mainland Chinese market, while we have the technical capabilities to perform the tests in our own laboratory in Hong Kong. And we have the rights for the next 10 years in Hong Kong and the rest of Southeast Asia. Also to highlight is that, certainly we've also recently have an agreement with Easy Healthcare, and certainly this was also brought to us, by Adrian Chang's ecosystem, given that they are also investors in Easy Healthcare. So Easy Healthcare is the largest medical group here in Hong Kong. They're listed on the Hong Kong Exchange with a market cap about $2 billion USD. So we've already signed an agreement to integrate ColoClear as well as all of our other testing services into their platform, which includes lots of annual patients, lots of annual checks, health checks, and day-to-day consumer patients. Moving on to the diagnostics business. So the diagnostics business today currently represents the majority of our current business, given that a lot of this work is related to COVID-19. Next. And with this, certainly we've been able to have some very, very high profile partners and customers. Here in Hong Kong, we're the #1 provider of COVID-19 testing in the community centers, at the Hong Kong International Airport, as well as the 36 quarantine hotels. So to date, we've already processed more than 4 million PCR laboratory tests with a daily capacity of approximately 30,000 daily in Hong Kong. In the UK, as Avi mentioned, we work a lot with the private sector, notably the Premier League, help them resume their season. We still are the provider to help them on their ongoing weekly tests for all 20 clubs, as well lots of the cruise lines, other sports organizations, and certainly as mentioned in terms of the airports, London Heathrow, Stansted, Manchester, etc. And with travel-wise, as you can see, we haven't forecasted back a resumption to travel, which is already happening, right? And then so we've been very, very conservative in these forecasts. So you can see last year there's virtually no travel. This year travel has already picked up. But moving on to future-wise, we believe there's a significant opportunity for us to capitalize on this, and we are very, very well positioned. Just to give you a fact-wise, so right now in Hong Kong International, we have approximately 1,000 people arriving daily. And certainly for all of these arrivals, we have to test them at the airport. Pre-COVID, there was 100,000 people arriving daily in Hong Kong International. Now, certainly that's not going to change overnight to get to 100,000, but over time-wise, we expect that to grow to 10,000, 15, 20,000 daily. And we haven't forecasted these upside projections into our initial forecast because certainly I think it's still unpredictable. But I think one thing is certain is that testing will remain here to stay for the next 18 to 24 months. And within that time frame wise, then there's a lot of upside. And moving forward wise, as mentioned, we're very excited about the Circle Health Pod. We made quite a big bet last year in terms of acquiring the IP from Oxford University. And it's taken us to actually launch the Circle Health Pod earlier a few weeks ago here in Hong Kong. And the reason why we're so excited about this is because if you think about your home, there's not really a health monitoring device. Besides your normal blood pressure or thermometer. But this device will be able to detect all infectious diseases starting with COVID-19. We're already in development work for influenza as well as certain STDs. So the idea here is that the device certainly is reusable, and then you'll have single-use capsules for all different types of diseases. Next, with this offering, we have 4 we start with the different SKUs, starting with the trial set, and retails for the device-wise $127 USD. And for the single-use capsules is approximately $20 to $25 USD. So very, very competitively priced given that it's a molecular test. So certainly from a B2B setting, you can actually put multiple pods. So certainly for offices, clinics, elderly care homes, schools. So there's lots of different use cases. As mentioned here, right? So because basically you can put this anywhere and be able to be applicable to be used very effectively. Similar here in terms of our marketing aspect here, we've been able to enlist quite large celebrities such as Donnie Yen, Ian Chan here in Hong Kong wise to help with the outreach of this product wise, right? And then so certainly it's been getting lots of great response here locally, and certainly we believe this product can be applicable worldwide as we go through the regulatory approval process. And the good thing here also with this product is that globally, there's only one company that we've seen as a comparable. It's a company called Q Health in the US, which listed on the NASDAQ a few months ago. So they're a single product company with this product, and they've been rolling this out into the US via the US government. Their market cap is roughly 1.6 billion USD. And certainly we believe we have a significant opportunity in the rest of the world with this device. Moving forward with the Circle Snapshot, again, we want to take healthcare and make it closer to the patient. We also believe this has a very, very strong user proposition, because today, a lot of times people, they can't get tested, or they need to go to a clinic or hospital to get their blood work. But imagine that you could be able to do that in the comfort of your own home without ever leaving, and then sending that blood back to the laboratory and getting results within 24 hours. So that's what the Circle Snapshot product does. I mean, again, we know already this model works, as evidenced by Everlywell, which our Dr. Frank Ong was formerly from. Everlywell's currently valuation is 2.9 billion USD, right, and growing very, very fast. And then so the idea here is that individuals and natural partners can be able to order their specific test they want to do online, and then we'll send the device to each individual's home. You send that back to us, so you can be able to test for certainly antibody testing, food sensitivity, female fertility, male hormones, and a wealth of different types of tests. So certainly I think we put the power of testing in the consumer's hands effortlessly, and saving the consumer's time and also money. In terms of the diagnostics business, again, Circle Medical, we feel that's a wide open market for us here in Hong Kong and the rest of Asia, as well as the UK. So this is basically Circle DNA, but for physicians. And as evidence, again, we know this model works, because certainly as consumers and even doctors are looking for advancements in technology. So we see this works in the US with Invitae. Invitae wise, again, they've been able to grow quite significantly over the last 5 years, and now to be a market cap of over 4 billion USD. And we believe we can also achieve similar traction and similar scalability given our credibility and reputation in the market. Lastly, with personalized care, we see a significant need from our existing customers, and also a significant want from our existing customers in terms of what's next after the genetic tests. So Circle One is basically personalized supplements tailored according to your genetic profile. So that means your supplements and my supplements will be different according to your results. And further to that wise, with Circle F1X and Circle FemWise, we believe there's also a significant opportunity in the space of prescription medicine with a telehealth consultation. Next. And we see this already being very, very successful again in the US. In the US wise, there's a company called Roman Health, which really has centered around 2 issues, centered around erectile dysfunction as well as male balding. And of course, these needs are very discreet and very private. But via telehealth, they've been able to make it scale, and now they're valued at 5 billion USD after just 5 years into the market. So again, we believe we have the attraction, the ability, and as well as the team to be able to execute and bring these products to the market. In the next few slides, I'm going to close it off and highlight in terms of what we have the opportunity and potential to do as an organization. So I think this is probably one of the most important slides in the presentation in terms of how we look at it, right? In terms of potential, this is why every day we still remain so excited about this journey that we're on. So today wise, we have an enterprise value 1.25 billion USD. With the IPO proceeds, we have 339 million from the trust. We raised a further 120 million in the PIPE and FPA combined. So that gives us approximately 459 USD in capital, which right now we are actually operationally profitable. So that means we have quite a big war chest, all right, going into our books. And then so if you look at three comparables, Exact Sciences, Invitae, and Natera, you see where they were 5 years ago. And then so certainly even 5 years ago, you can even make a case that from a financial perspective, we're in even better shape. 5 years ago, Exact Sciences was actually just listed. They had $1.3 billion market cap. Now today they're 14 billion. All right. Invitae, they were listed 5 years ago, 250 million USD market, quite small at the time, and now they're all 4 billion. Natera, similar, they were listed at 600 million USD and now 10 billion USD. So certainly, I think where we're at today, it's an incredibly exciting time because certainly we know what the playbook is. Right. Next is that the playbook is, look at Exact and Invitae. They've made 23 acquisitions in the last 5 years. So our team has already started identifying targets in the area of rapid diagnostics, targets in the area of digital health, telehealth in both US, Southeast Asia, and in Europe. So with this, we believe that certainly we have significant opportunities to be able to grow to a much larger organization from 1.25 billion to potentially be a $5 to $10 billion company in the next 5 to 10 years. So again, showing you again what we aim to do from the first slide when I started the opening remarks is that imagine you have one user coming into our Circle ecosystem. That one user can actually do a multitude of testing: Circle DNA, Circle Snapshot, colorectal cancer screening, telehealth, prescription medicines, personalized care. So each single individual that we may use, let's say $100, $200 for customer acquisition, that lifetime value of that customer could be 10, 20-fold. Because ultimately we want to build a very strong relationship with that patient. Ultimately, potentially even from the moment that you are born until the moment that you die, there's a test or offering that you will come to Prenetics for. So with that, I will end our presentation and open it up for Q&A for everyone here in Hong Kong, as well as everyone dialing in virtually. Thank you so much. Sure.
So we'll pass you the mic.
Yeah. Can you say your name and where you?
Yeah, I'm David from Citibank. So my question is about the synergy between Prenetics and Artisan. So how can we develop the synergy between Prenetics and Artisan, and can we have more detailed plan about this?
Sure. Certainly a very valid point, right? And so certainly that's one of the big reasons why we chose Adrian and his ecosystem, right? Of course, everyone I think in Hong Kong needs no introduction to Adrian New World Development. So certainly they're one of the biggest conglomerates here in the region. So I think they have assets of close to 100 billion USD, given their conglomerate wise, right? For the individuals that are not dialing from not dialing from outside of Hong Kong. So in terms of synergies, right? So certainly I think if you look at their synergies wise, they touch upon 14 million consumers across their portfolio of real estate, shopping malls, and healthcare. So of course, the immediate synergies that we are working with now are within their healthcare network, which evolve around Easy Healthcare. And again, they have about 100 plus clinics here in Hong Kong. So we already signed an agreement to integrate our testing and services into their platforms. So I'll give you an example. They do roughly 200,000 to 300,000 annual health checks every single year, right? So imagine these 200,000, 300,000 health checks. Right now, they are not getting genetic testing. They are not doing colorectal cancer screening, right? So that means we have a direct synergy into introducing our products to that platform and being able to upsell to that customer, right? And so certainly with Gleneagles Hospital, of course, then certainly there's a potential to integrate our services into that platform as well. They also own Humanza. They also own FT Life, which is a big insurance company here locally. So that's kind of where we're starting with. And then certainly afterwards, then certainly we'll then start to think about, okay, how do we integrate with real estate, the shopping malls, etc. So, Adrian and his team have been very, very supportive, and certainly this is his first SPAC. So I'm sure as know that means, that's very, very important for him.
Hi, everyone. Thank you. This is Jason from Credit Suisse. Thank you, everyone, for giving this opportunity. I had a question on the company's go-to-market strategy for specifically China. I think that it's very clear that management is able to provide us with more kind of financial details as to what projections may look like. But I guess if we are looking at the China market, which products or which of our businesses do we see that to be one of our big focuses? Obviously, because New Horizons partnership with us would not be related to China. And so would it be with Circle? Would it be with some of our other products? So just a little more color on this. Thank you.
A very good question, a very easy question, actually. So actually right now we have zero ambitions for the Chinese market, or China mainland market, right? Because I think if you ultimately look at where we've been successful in UK and Hong Kong, we've been able to build it over to 200 million USD annual revenue company already. And I think realistically, even if you look at our team, the way we're structured wise, even myself wise, we're definitely not the best team to execute in China. Right. So I think we have to be realistic in terms of where our expertise lies, where our team lies, and where we can win. Right. Because I think China-wise, it's a very highly competitive, highly regulated market. So we believe actually we can have a significant opportunity in the overseas market. Certainly Hong Kong, Southeast Asia. For example, Southeast Asia-wise, I think significant untapped market with 600 million in population. Right. So one of our pipe investors is actually Lippo Group. So Lippo Group, they're the largest hospital group in Indonesia. Right. So they actually own 50 hospitals, the Siloam hospitals, which about 2 to 3 million patients go in. So certainly we're discussing with Lippo in terms of how do we bring our testing services into Indonesia. Right. Philippines, we're also working with a major laboratory there that's doing a lot of the current testing. Singapore, Malaysia as well. So I think we have significant opportunity to be able to tap onto these untapped markets, because the reality is there's no competition in these markets. Once we get regulatory approval, then we believe we can have significant opportunity for each one of our products, which include, of course, Colo Clear, the Health Pod, and the rest of our products. And certainly in the UK and Europe wise, right, we believe that we have a significant opportunity to win in these markets, given our team, existing footprint, and certainly our credibility in these markets. And certainly I think moving forward wise, we're looking for opportunities for acquisitions in the US as well. Right?
But then we need to set up a central lab in each of these countries, specifically in Southeast Asia, to then service the markets, or can all these samples be sent, I guess, to Hong Kong?
So it depends on which products these are, correct? So certainly some of these products or some of the tests can be sent to Hong Kong, as long as the volume warrants it. So certainly, let's say in Indonesia wise, right? We don't need to set up we wouldn't need to set up a laboratory, because we can leverage off of Siloam's hospital's laboratory. Correct, but they already actually have laboratories, right, for the hospital network. So we'll be able to leverage off that and be able to, but certainly what we'll be able to bring is the technology and the expertise, because they don't have the technology. They don't have the expertise to be able to launch these products in the local market. They don't have the IP, right? So certainly depending on which market, which partner, but the idea is to be able to initially leverage off existing laboratories. Certainly that will actually lower our CapEx as well.
For those who are joining us virtually, you can ask questions by typing it at the Q&A box in the bottom of your screen on Zoom. Thank you.
Thanks. Justin Kwok with Goldman. Maybe I'll jump in with 2 questions. One is you touch on a bit on the M&A side, and potentially in the US, where you got 450 million more or less cash on the balance sheet. So can you share a bit more what you're looking at in terms of the opportunities, which vertical or which geography, in a way that investors, about, like, say, in 2-3 years time, what should they look at as a company? What will you be doing? I think the first one. And secondly, I think in the discussion, when you talk about the Circle DNA, you mentioned the peers like 23. and me, and they are probably kind of undercharging in order to get some data from the consumer. And with your pricing, and what are you doing with the data as well? So are you not over you price it on the reasonable way so that you're not sharing data, or what were you looking at that? Thanks.
Sure. Thank you, Justin. So I think on the first question, in terms of M&A wise, right, what we're looking at, so certainly we are looking at a variety of different types of companies, right? So in the US and Europe, even Southeast Asia, anything that helps us complete our story, right, or add synergistic value to our story. So this ranges from digital health or telehealth companies, other rapid technologies, rapid diagnostics technologies that can actually work in point of care or at home settings. Yeah, so let's say immunoassays, yeah, something that we're looking at, other forms of rapid molecular tests that we're looking at. So also even in the area of women's health and men's health, right? So we're looking at even supplements or prescription medicines companies, right? Which has already created a strong following, strong brand. So we're actually looking across the scope of either prevention, diagnostics, and personalized care. Because I think if we do have the capital wise, I mean, certainly a lot of these things we can build ourselves. But if we have the capital wise, it's much, much better to be able to acquire rather than just to build organically. Right. And so certainly I think one key thing is that, even from my background wise, as always, we believe here in Asia wise, we have a significant opportunity to develop what you call kind of like super apps, right? Complementing a lot of different testing or services within one ecosystem, where I think that's kind of different in the US, right? So I think you can even make a analogy, even let's say in the US, right? I mean, even Uber is still very predominantly Uber Eats wise, but if you look at Grab in Southeast Asia wise, and Grab is a lot of different things, right? You have Grab, you have Grab Food, deliveries. Now you even have Grab Health, even Grab Financial, because basically they're able to leverage their brand into which has resonated with consumers, and then that's kind of a cultural difference that people trust. And so if we're able to build upon that, and again, once we get that customer, Prenetics customer in, they can do many different areas of testing and services, right? In terms of your second question, in terms of the data piece, right? Right now, we are not sharing or utilizing that data with any third-party provider, right? Because I think right now we're still not at the stage where we can have fruitful discussions. Because the good news is that right now, again, we make profit on every single test that we sell. All right, so that's the key differentiation, right? Because if we are not making money on every single test that we sell, then we have to actually start thinking about other ways. How do we monetize that? But we are able to make a decent profit on every test that we sell. So that creates much more opportunity for us and much more time for us to build a much stronger, much bigger database that we can then certainly make use of that. But I can even say right now, given that our 130,000 database with Circle DNA, which is whole exome sequencing, it's a lot of data there. And we're probably one of the largest company, we're probably the company that has the largest East Asian database of genomic profiles, right? So certainly, again, to be fair, it's probably quite difficult to quantify what that value is, but certainly I think we can all agree there is going to be value in there. Any other questions here from the people here in attendance? Yeah. Okay.
I can keep on doing it for hours.
Yes, okay,
Justin of Goldman again. Sorry.
Thank you, Justin.
No, sorry. Just another question I'm actually interesting to understand is because the way you look at the different products and the way you evolve is you kind of started with a B2C in some of the marketing, but then now in Hong Kong, you are effectively doing more like a B2B2C way of running the business. So when you move to ASEAN or when you have the new products coming in, how are you going to decide what you're going to do with that, given the size of your company, given the potential selling marketing expense involved, and how you're going to position different things via channels like Gleneagles or Easy Healthcare, or where you try to do it on yourself, where you need to do a lot of marketing on the tram or Enroll Mirror and all these things. So I guess just in a way, it's if investors look at it, is because if you look at a few of the names you mentioned here in some of the slides, some of these, I don't think the consumer actually know these names because you are actually hiding behind some of the medical labs or your doctors, where some of the names you do have a consumer brand where people value. So how are you going to balance these?
Yeah,
Thanks.
I mean, very, very good question, right? So I think we have a very unique mix of both B2B to B2C. The reality is actually even in when we started Prenetics back in 2014, our first product was actually B2B. All right, so because we actually were working with insurance companies initially, providing insurance companies the genetic tests that they can actually provide to their insured customers. So because they have a vested interest, right? They want people to be living healthy, longer lives, right? So I think certainly to be honest, it's quite rare to see such a company diving into both B2C and B2B because the mentality or mindset or the team is so different, right? So I think this is where we do have a very unique mix in terms of the team that can execute on both the direct to consumer side. And certainly, again, direct to consumer, I mean, realistically, is all e-commerce, right? And then so previously, I built the largest e-commerce company in the region with Groupon, right? Even B2B, I previously dived into hotel furniture, and that's all B2B. So I think certainly for a lot of the other products, it depends what the products are, and then we'll identify what that market is. So for example, give you an example, for HealthPod, that will 100% be a B2B play. Right, correct. That will be for offices, airlines, airports. So we put in, the Circle Health Pod in Hong Kong International Airport already for departure testing. Right, governments, elderly care homes, schools, etc. Right. So because I think, we always look at the value proposition in terms of what is best value proposition, and then for HealthPod B2B 100%, for ColoClear that's also 100%. For physician-driven, B2B wise, right? Because I think reality is it's going to be very difficult for someone going online to buy a stool DNA test for colorectal cancer, right? No matter how biased I am, I think we have a good reality with the consumer in terms of consumer behavior. A doctor that tells you, you know what, you should actually do this ColoClear test. You do not have to do a colonoscopy. That's much greater value than any marketing that will do. Right. So I think it just depends on the product wise. And then we'll identify if it's B2B or B2C.
Just another question on, because I see the Circle Medical, I think is a very interesting business as well. And from what I understand, it sounds like from the Circle Medical perspective, the growth really is to go into small, medium, large panel testings.
Correct.
And specifically, we know that, I mean, at least within China, we see that there are either your LDT-based tests or your IVD-based tests, whereas for the IVD tests, you do require some kind of clinical trials that you need to test for sensitivity and specificity. And so I was wondering for our Circle Medical business, are we looking at PCR-based, NGS-based tests? Are we doing LDT? Are we doing IVD? And I guess then specifically markets where this is aiming for.
Sure. So for the Circle Medical wise, right, it's basically Circle DNA. So Circle DNA is actually a clinical grade genomic test, and because we are utilizing whole exome sequencing technology, right? So and by default, it's NGS based, right? And then but we've talked to a lot of physicians in Hong Kong and Southeast Asia, and they actually really love the Circle DNA product. Now, the challenge for physicians is that it's too much information. Yeah, because if let's say you have a patient come in, there's 500 reports, the doctor has no time to explain to you what all these 500 reports mean, right? Correct. So that's why we're breaking it down to smaller panels, specifically, let's say for cholesterol, right? For specific panels. And that's what doctors then, based upon their specialty or specific areas they want to identify, to look at genetic tests. Right. And so that's how we think about it. And again, right now, I think it's even Hong Kong wise or Southeast Asia, there's no providers that have gotten any type of scale, right? Because number one wise, they haven't done, very few companies are such well capitalized to be able to invest in the R&D and the technology piece, right? To be able to bring it to market. What's happening today in this part of the world is that they're sending actually a lot of the samples back to the USA for testing. Right. And then, of course, that gets very expensive. The time to results is much longer. But certainly, I think if we can do it here in this part of the world, and certainly in the UK and Europe wise, then significant opportunity. Right.
like liquid biopsies or
Not
tissue
at this
biopsies?
stage wise, that's not in our roadmap. Yeah.
Thanks, Justin. Again, so I actually got two questions coming in from my teammates.
Great.
Unfortunately, they got stuck in quarantine now in different part of China.
Okay.
No, but actually more to guess two more technical questions. Which one is on the colloquia, and the other one it's on the kind of health pod kind of quality of test. On the colloquia side, do you actually share a bit of where you're looking at in terms of the sales target or the number of tests what you're having for the near term, and then what kind of pricing you're going to do on the B2B side? And the second one on the health pod is, I guess, because the way you describe it is called the equivalent to PCR test.
Correct.
So is that not exactly a PCR test in a way? In that sense, is how you can envision whether the potentially even the authority like the government would actually adopt this or not. So how do you look at that level of qualification or certification in not the way in terms of the quality of test, but then more like whether the government actually recognize as a proper result for more official purposes?
Yeah,
Thanks.
got it. So the first question on colloquia wise, right? And so in terms of the actual details, in terms of number of tests that we're looking to roll out, we'll be releasing more information on this after Q1. During Q1, right? Because certainly right now, we're still working with our partners, certainly EC Healthcare as well as a few others to identify what that potential volume is. And then so certainly we'll have more guidance in Q1. For the second question, so for the health pod wise, right? So we say it's a PCR accuracy type of test, right? So there's PCR laboratory tests, certainly that requires a laboratory. There's also a molecular type of testing. So molecular testing, RT-LAMP, is also considered molecular tests. So this is much more accurate than the antigen type of testing. Right, correct. So that's why we call it PCR, because at the end of the day, I think consumers or even doctors or B2B sector, they know this term, right? So, and even if you look at into the US FDA, they'll group under RT-LAMP and also PCR testing as one group of molecular diagnostic testing, right? And then the other group of testing is actually antigen testing. And again, as Mike mentioned earlier, the antigen testing is actually very accurate if you have symptoms. So even if you look at the IFUs or the instructions for use, it says use within the first 7 days of symptoms. The challenge is that if you don't have symptoms or asymptomatic wise, antigen misses a lot of those cases, right? Because antigen, the CT cutoff is roughly CT 28 at the best. But for molecular tests, you're looking at CT cutoff of 35. Okay, so you are able to then capture the individuals with very low viral loads, which then certainly think this is very important. And certainly that's why the value of molecular tests will always be the gold standard of testing.
In terms of government adoption.
In terms of government adoption wise, right? So certainly we've already gotten the CE-IVD mark for the health pod piece. Or right now we've already started, we've completed the usability studies in the US, and we're also undergoing clinical studies right now in the US. And then so we expect to be able to complete that within the next 4 to 6 weeks in the US, then submit it to the FDA as EUA approval. And then hopefully by early Q2, we can get approvals in the US, and then which will allow us to sell in the US. At the same time, in Southeast Asia, we are also submitting to regulatory authorities our healthbot data. Right, so we actually expect in Q1 and Q2 wise to also expect to get regulatory approval for the few of the countries in Southeast Asia, because what we've seen also, again, I think here in Hong Kong wise, I think it's been we've been very safe with COVID, but I think still in Southeast Asia, and then with travel already resuming in that part of the world, cases are still going to be there. So that means testing is also going to be very important for individuals at home and businesses to reopen. I think in Southeast Asia, there's a lot of factories which require testing when you go into work, right? And so certainly I think having a rapid molecular test at point of care is going to play a very important role in this reopening.
We have two questions online from Kyle from Canaccord. The first one is, could you or do you want to eventually participate in population genomics, similar to what Helix does in the US?
Yeah, so certainly, I mean, we know Helix very well in the U.S. population. I mean, they partner with Nevada, a few other states as well on population genomics, right? So certainly, this right now has not been something that we've looked into, quite honestly. However, we are looking to work more so with the private aspect. So, for example, we are looking to actually integrate with EC Healthcare, and EC Healthcare already does a few 100,000 blood tests annually on health. So the idea here is that we integrate genomics with their blood testing. So certainly that becomes very, very valuable information for that patient, as well as data that we can actually potentially use for other purposes, such as drug discovery, or even potentially in providing that information to the government for disease policies and policy steering.
The second question is, most of your genetic test applications are looking at short base pairs. How are your long read sequencing being used today? And what are your plans for using long read going forward, especially in the UK or Hong Kong?
Very, very good question. So right now we are also exploring, we've already doing R&D on the PacBio systems to be able to utilize both long and short read sequencing for different use cases, especially for B2B aspects and also for direct to consumer aspects, right? So there are different technologies that are available today. And depending on, again, on the use case, we'll be able to identify if that's the best use for direct to consumer or for clinical use for physicians. Because I think one thing that we can add is that because of the PacBio sequencing platform, we can potentially lower the cost of that testing to the patients. Because right now we're doing whole exome sequencing, which is quite expensive to run that. Yeah, but if we're able to utilize the PacBio system, we can actually potentially, for example, even be able to do BRCA1, BRCA2 testing, versus breast cancer for under 100 USD. So certainly that would make it very, very affordable for a lot of patients in that type of setting. Was there another question? Or no, that was it. Any other questions from people here or online? Yeah. With no other questions, for all of us here in Hong Kong, we will conclude, and we'll also be followed by a laboratory tour, which is across the street. So you guys can see actually where everything works and even ask more questions, right? So thank you so much for everyone dialing in online in the US. Thank you so much. I know it's in the evening as well as in the UK. And certainly we hope to be able to build a long relationship and help you understand a little bit more about Prenetics and our journey moving forward. But I'd like to conclude that, certainly we believe we're just getting started and there's significant opportunity and potential for the future. Thank you.